Her Excellency, the First Lady of Zimbabwe and the Ambassador of Merck Foundation, More Than a Mother, Her Excellency Amai Dr. AUXILLIA MNANGAGWA, please join the stage. Thank you.
Thank you very much. Please be seated. Good morning to you all, and welcome to the program. I'm very happy that once more we are receiving Dr. Khaled and the chairman, Mr. Haverkamp. The journey that we traveled has taken quite a lot, and it has included you in the journey. But what I can say now is all those women that you saw are the first ladies of Africa. And she has managed, the Merck Foundation has managed to bring us together, which ourselves sometimes we cannot do it. But the power in this foundation is something else. Now that's where we meet as first ladies, we share and get to know who is doing what in a country. It comes also as an educative program that what I am not doing here, I'll hear it from other countries, and I'll come and do it after this roundtable. But I want to welcome you all today, that it's a day that strengthens and develops you and also gives you more choice of what you want to do further, given the areas that you are specializing in. I want to say to you, thank you very much for visiting Zimbabwe once more, and that we continue to work together. Our valuable partners, Chairman of Merck Foundation, Board of Trustees, Professor Frank Haverkamp, the Chief Executive Officer of Merck Foundation, Senator Dr. Rasha Khaled, our Minister of Health and Childcare, Honorable Dr. Mombeshora, distinguished future healthcare experts and policymakers. I've seen some of the policymakers coming in here. Merck Foundation Alumni of Zimbabwe, distinguished media partners and winners of Merck Foundation Awards, health and social community champions, ladies and gentlemen. I'm very happy to host our long-term partner, Professor Frank Haverkamp, Chairman of Merck Foundation, and my dear sister, Senator Dr. Rasha Khaled, the CEO of Merck Foundation. I welcome you and Merck Foundation team to our country and beautiful country of Zimbabwe. Once again, to celebrate together the 7th anniversary of our long-term partnership between Zimbabwe and Merck Foundation through my office and Angel of Hope Foundation. This is a great milestone. Therefore, we are all meeting today for Merck Foundation Zimbabwe Alumni Summit 2025 to appreciate this great milestone of an outstanding success of our joint programs and share the impact of this long-term partnership that we have with Merck Foundation since 2018. The 2018 we are talking about, that's the first time we met in Senegal. And the actual program started in 2019 to build healthcare capacity, transform patient care landscape, break infertility stigma, and support girl education in our country. Moreover, I'm looking forward to meet and acknowledge all of you, the future healthcare experts of Zimbabwe, the Merck Foundation alumni, the winners of Merck Foundation Awards, who are our health and social community champions of raising awareness about many critical health and social issues, and the brilliant part underprivileged schoolgirls who are the beneficiaries of Educating Linda program. I am proud of each one of you and keep up the good work. If you want to look at this, the Merck Foundation has touched so many areas They are in education, health, social, bringing media, and also policymakers are here. Ladies and gentlemen, it was after the global pandemic COVID-19 that we realized that the grave need and importance of advancing public healthcare sector. I would like to take this opportunity to greatly acknowledge the valuable partnership that we have with Merck Foundation, and to be the Merck Foundation more than a mother ambassador, to transform the patient care in our country by providing specialty training for our local doctors. It is truly unbelievable what we've managed to achieve so much in a short time. I am proud to share that Merck Foundation has provided 166 scholarships for our local doctors in 44 critical and underserved specialties, essential for our country's health care system. I would like to share with you all a summary of 166 scholarships provided. Out of the total of 166, 60 scholarships have been provided to doctors in diabetes, endocrinology, cardiology, cardiovascular preventive, obesity, and weight management. This represents a significant number of experts in the public healthcare system, addressing the lifestyle-related health issues that are on the rise in our country and the rest of Africa. These specialists will have the expertise to establish dedicated clinics in hospitals and health centers, significantly enhancing the prevention and management of diabetes, hypertension, and heart diseases, bringing immense benefits to our people. A total of 48 scholarships have been awarded in fertility, embryology, and the one-year diploma and two-year master degree programs in sexual and reproductive care, women's health, family medicine, and psychiatry. As the ambassador of Merck Foundation More Than a Mother, I see these scholarships as highly significant, not only in breaking the stigma surrounding infertility, but also in advancing women's health. This initiative will play a crucial role in transforming fertility care and sexual and reproductive health care across our country. Additionally, 58 scholarships have been awarded in critical and yet underserved specialties, including oncology and cancer care, respiratory care, acute medicine, pain management, infectious diseases, dermatology, psychiatry, neurosurgery, neurology, neuroimaging for research, pediatrics, orthopedics, critical care, care for older persons, and rheumatology. These fields are essential for strengthening our healthcare system and improving patient care nationwide, and advancing healthcare capacity is extremely critical to the development of our nation. I actively work with our Ministry of Health and to monitor program outcomes and engage with beneficiaries, ensuring the effective utilization of this opportunity to enhance access to quality and equitable health care in our public sector. This is for the first time that we work on such an impactful program. It is history in our country. I am proud for all of you, the Merck Foundation alumni from Zimbabwe, who are either graduated or are undergoing the training currently. You are the future healthcare experts of our country. Ladies and gentlemen, I would now like to draw your attention towards another important program that we are implementing together very successfully, the Educating Linda program. This one now is for our schoolgirls, as you saw them when they stood up. As a part of this program, together with Merck Foundation, we are providing annual scholarships to support the education of 40 high-performing yet underprivileged schoolgirls till they graduate. Additionally, we are also distributing essential school supplies to thousands of school children, further supporting their education and ensuring they have the resources they need to succeed. We can all agree that educating girls is fundamental to individual empowerment, societal progress, and economic development. Regai ndimbokuvunza indichiti. Yes, tine vana vedu vakomana handiti, but we have put vamwe vari kuti tanyanya kuti vasikana. Ezvinezvi pakati pafiwa panapa. Ndiani angasumuka achiti baba we. Ndiani? Anisa ndakambozvinzwa ini. Munhu wese anongoti chi? Amai we. Nana baba vanotiwo futi ana baba aiwa tinoda kutaura chokwadi. Munoti baba we kana kuti munoti na amai we kuzvafamba seko. Asi wedzire kuti amai we. Meaning kuti the mother is very important. Saka educating Linda is not kuti we are saying our boys are out of the map, no. But we want to strengthen this Linda, who is now the mother, who is now taking care of even yourself, Baba, there, the husband, that Linda is going to. So we want to educate her so that kana Baba, zvazotadza tinoshare tinobatsirana handiti zvazvinoreva. Ezvinezvi mari ikauya tikatawana kamari kokuti hatine toenda project kandi baba mari indawana yangu tozoona na after work pane nyaya. Amai will bring back the money kumba at home because she thinks and she knows. Baba takes that money and it goes forever. And if you ask, for you, if you ask Baba, what happened to the money that we promised each other in the morning? GBV, gender-based violence, starts from there. And it grows until takutorambana. Nokuti wavunzire kuti where is the money, where did I put the money, where did I take the money to? So that's life, but we are saying let's accept each other and develop ourselves. And as much as you know that Merck Foundation and Angel of Hope, we are dealing with the family unit. That's where it starts from. So ndoda kuti kwamuri madoctors, media yedu, thank you very much. Makati koshera. We love you. Me, Angel of Hope, and Merck Foundation. Because if we have these meetings, we talk and talk every day, without my journalists, without media, it doesn't help at all. Nobody knows where we are and what we are doing. So we respect you in your fields and what capacities that you are in. We can all agree that educating girls is fundamental to individual empowerment, societal progress, and economic development. It paves way for reduced poverty, better health outcomes, and greater opportunities for women to take part in decision-making and contribute meaningfully to their communities. Therefore, I hold the educating Linda in a very high regard. I'm very happy that today we are also meeting the beneficiaries of the program. Our hardworking young schoolgirls, I want to tell you all that you are truly lucky to have this opportunity to reach your full potential and pursue your dreams. And you are proud to be part of your journey towards a bright future. Vana vangu vasikana, you are still growing, you are in school. There are so many social ills that are affecting our youngsters today. There's this drug menace, drug addiction, and it's touching all across. Even anababa, nima doctors futi, I was reading umamusa angu, nima doctors are also being affected with drugs. And yet we are looking up to you. Doko tandarwara, apa yo ni drug rako doko tarawatora, ina andinga receive. So I don't know what prescription I'm sending your ndiyo ere. Saka we are in it, Tese, and we need to fight it, Zakasimba, because it has come to destroy our lives. So, those who are in this scholarship, make sure you study hard and just be aware, don't be involved, indulge in this drug menace. And danana kuchikoro, ndazviona kakatiwa ndiye muchikoro mandiri kufamba. Vana vadiki makudanana, manema love affairs imomo, you know, you love this one. What does love mean to you at your age? It just brings problems for you and it destroys you, mwanangu. We are looking at you. Tomorrow you'll be looking after us. So you need to put all your effort that you achieve and get what we want you to be in future. Ladies and gentlemen, we are also working together very closely to address and raise awareness about many critical and sensitive social and health issues, like breaking the stigma of infertility, ending GBV, supporting girl education, diabetes and hypertension awareness, and many more. Today, we have few of our women who are here. She has told us the problems that they are facing. And if we wanted to ask her more what they've gone through, I think we're going to shed tears. Kumanzi tunonwiswa mazai. When I sit down with them, listening their stories, you know, you just feel improper. But now speaking loud like this and openly, it was something that wasn't happening in our country. You would hide, and you don't want people to know that you are in this problem. But we are saying, come out, let's share. Nakuti, if we look at the marriage issues, normally the infertility problem is blamed to the mother, to the wife. But when we come to you professionals, health professionals, you say, no, come to us. It affects both the man and the woman. But kumba kwandinobva, amukoka, zvirungonzi ndini, saka ndoita sei. Saka tata Amai, we are to come and speak openly. Kuti Iowa is not a case, but it's an issue that we should notice and live in it and promote and kunonzi kusimbisa kuti ndozviripo, and we understand this problem. Thank you very much, Mama, for highlighting all this, and you're coming with other women that you have come with, representing other women. Otherwise, we have them in all 10 provinces. Thank you very much for coming. We have launched together 7 children's storybooks, More Than a Mother, Educating Rujeko, Make the Right Choice, Jackline's Rescue, Not You Should Know Who You Are, Ride Into the Future, Sugar-Free Jude. I think some of these you saw them per screen. Sugar-Free Jude, and Max Pressure. These books address very important issues to our young children. We have received thousands of copies of these storybooks, and I have distributed them to school children. More copies are still coming and are going to come to be distributed soon. These are done and printed by Merck Foundation. We are trying by all means, Merck Foundation is trying by all means that we should harness, or we should be on top of our children's life to direct them, give them the proper way of growing. So all these books, kanari mwana arikuza uti ndabva kuvabereki. Book iroro can turn your mind, can change your mindset. So we are fighting tose for the children who are still growing. Moreover, we have conducted 6 editions of the Merck Foundation Youth Media Training for our journalists in order to educate them on how to raise awareness about sensitive issues like breaking infertility stigma, supporting girl education, stopping GBV, ending child marriages, and raise awareness about diabetes and hypertension prevention and early detection. Now we have this cancer issue again. So my journalists, we cannot do things zvatirikuita musipo. Ndimi munozoshambaza nokuti munazozvishamba handizve kuti huro dzenyu dzakasiyana nedzangu here naimi kana kuti magadgets amunawo handiti. Saka make sure kuti we walk, we travel, we walk together. Pandiri ndo pamuri muchishambadza nokuti voice renyu is heard kuma areas aya ari kure, kuma remote areas kune vanota kungonzwira kuti radio yati. So we need your services. Please be with us, walk with us in all the endeavors, in all what we are trying to do. We also annually conduct the awards for best media, songs, films, and fashion designs to address these important social and health issues. I am proud that we have celebrated more than 60 winners so far. I'm happy to meet many of you today. Ladies and gentlemen, we will continue meeting every year through this platform to discuss our journey and evaluate our progress. Once again, I thank my dear sister, Dr. Rasha Kellage, and Professor Frank Haverkamp for visiting us. On behalf of the people of Zimbabwe, we welcome the long-term partnership with Merck Foundation to build healthcare capacity, media capacity, and address the health and social challenges in our beautiful country. Dinokutendai, thank you very much.